From my understanding, this is the first time that Nevada Medicaid has rescinded a policy.
Nevada is removing a limit on mental health care appointments. Why medical providers are pleased with this decision? In tonight's 2 News Big Story at 5:30, the state will not move forward with the Medicaid policy proposal that would have limited mental health patients to just 5 sessions before getting prior authorization. I'm Landon Miller.
And I'm Kristen Remington. Prior authorization is a process where patients need to show medical need before receiving further treatment. Elizabeth Lavetta was at that public workshop today. And Liz, what were the providers' biggest concerns?
Well, Kristen, they really worried that this would just put one more obstacle between a patient finally receiving treatment, but the state and Medicaid heard them out and pulled back on their proposal that was supposed to go into effect next week.
We made it. We did it.
Mental health providers rejoiced Thursday after fearing the worst.
There had been times where we felt like the entire state of Nevada was going to lose mental health for all the Medicaid population.
A policy proposal would make providers get prior authorization before deeming treatment necessary for mental health patients. The biggest concern was patients possibly harming themselves in the 5-day period it takes to process.
After getting a lot of feedback from the community that 5-session rule was going to be problematic,
the state sat down in focus groups to hear out patients and providers firsthand.
They've been open-minded and listened.
Protocol will now go back to original policy. In psychotherapy, that's 18 sessions allotted for adults per year. Patients under 18 will get 26. In neurotherapy, the number of sessions is determined case by case. For either service, prior authorization is only required for additional appointments past those allotted.
and we can prior authorize additional services for somebody who's severely impacted or making great project progress and almost there.
Medicaid fraud and allocating those Medicaid dollars to patients who need it most is why the 5-limit proposal was created to begin with, according to the state. Both sides hope to continue to work together to find better solutions.
So that fraud, waste, and abuse is reduced and services are going to the recipients that need it.
People are getting services that help them get better, and that there are services being provided when we're paying for them.
Now, for state protocol purposes, the official rescinding of that policy goes into effect October 25th. Covering the big story live, Elizabeth Olveda, 2 News.